Both stria, they occur because there is corneal thinning. Due to that corneal thinning, the cornea, it bulges out. And as it bulges out, elongate हो रहा है, there's traction meaning there's a pull in the normal stromal fibers. And due to that pull, there appear spaces or gaps inside this normal stroma, which should have been clear like this. उस टेंशन की वजह से, टेंशन मीनिंग दैट टेंशन ऑन द स्ट्रोमा, उसकी वजह से these stria appear, and these are called Ward stria. These are Ward stria, these lines, these parallel lines in the corneal stroma. So Ward stria and Munsell sign. We've done two important signs. Now look at this picture again. This is again a slit lamp examination. And this time it's not so much a slit. We're not seeing a slit, but it's diffuse light. Not diffuse nahi hai. It's focus light. And the slit is most probably coming from in the front of the patient. इसमें हमें क्या नजर आ रहा है? Very margin. Iris है. This is the cornea in front of the pupil.
साइड व्यू है,
क्या हुआ है?
ये साइड व्यू है.
नहीं front व्यू है. This is the front. These are the eyelashes. This is the pupillary margin. ये limbus है यहाँ पे. This is the sclera. This slit ऐसे light की arrangement ऐसी है कि it appears to be a side view, but it's not. This is the whole of the cornea. ये sclera है. ये limbus जा रहा है इधर से और इधर से. Looking at the front.
इसमें से नेजल और मीडियल साइड हमें कैसे पता लगेगी? नेजल है या टेम्पोरल?
नहीं पता लगती हमें नहीं पता लग रही, but that is not relevant to the signs which are present in this picture. So जो कुछ तो नजर आ रहा है, there's something you guys must be seeing.
जो white lines हैं.
White lines हैं, again those white lines, ठीक है? Those white lines, where are these lines present? These are those white lines. These are white lines, and their arrangement is थोड़े से myocytes की तरह के मुझे लग रहा है. They're more or less parallel. These are again Ward stria. ठीक है? ये Ward stria हैं जो आपको slit temp examination में मिलेंगे. These are an important sign. This is not the only sign in this picture. Look again and look closely. कोई और लाइन आपको नजर आ रही है इस पिक्चर के अंदर?
जो नीचे है.
नीचे भी ये Ward stria ही हैं. I think they are all, and these are the Ward stria. फिर ये थोड़े बहुत इधर हैं. They are all pointing towards somewhere over here. मुझे लग रहा है कि the apex of the keratoconus should be around somewhere over here because of the pointing. ये इस तरफ जा रहे हैं, ये इस तरफ जा रहे हैं, but it should be here. Those are again Ward stria. That's a good pick. थोड़ा सा ऊपर देखें.
एक लाइन सी है ब्लैक.
एक black सी लाइन जा रही है. There's a black horizontal line which is moving across. So we have a black or horizontal line. Now what I do is I change the light from normal light, yellow light of sunlight. I introduce cobalt blue light into the same eye. This is cobalt blue light and everything is appearing bluish. So this is the limbus. This is actually the pupillary margin. And that black line which we saw further, this is that line. तो ये क्या है? Chalo, I will tell you the name if someone describes to me what this line is or how we can see it. तो अभी हमने पूरा एक किस्सा कहानी की है.
Deposits.
Not the deposits, what I've told you or what we've seen. क्या है? थोड़ी सी description इसकी बताएं. Not nature, but you see. Just describe what you're seeing.
A horizontal line
Horizontal
in the upper
line.
part of cornea.
In the upper part of the cornea. It's a horizontal line in the upper part of the cornea. All right. And it's visualized using
Cobalt blue, and वैसे it's somewhat brown.
yes, it's somewhat brown in color, and it's best visualized by cobalt blue light. This is called a Fleischer ring. Please differentiate this from Kaiser-Fleischer ring. This is not a Kaiser-Fleischer ring. This is a Fleischer ring. Okay? A Fleischer ring is the third important sign of keratoconus. And it is a line or a ring. Okay? The ring is more ever clear in this ring. It's a line or a ring around the base of the bulge in a keratoconus. In keratoconus में जो bulge है, if this is the bulge, its space should be around here somewhere, right? This is the bulge, its space should be around here, inside the cornea. So it's a bulge around the base. It's a Fleischer ring. It's a ring at the base of the keratoconus. It is best visualized. It's brown or yellowish in color. It's best visualized under cobalt blue light, and it is caused by the deposition of Kaiser-Fleischer ring. हमने discuss किया था. It was deposited. It was due to the deposition of copper. So Fleischer ring, it's due to the deposition of iron. This is very confusing. Start में मुझे भी समझ नहीं आती थी कि what's a Fleischer ring and what's a Kaiser-Fleischer ring, and I thought that all right, Kaiser-Fleischer ring को छोटा गिर के सुस्त हो गया, मैंने Fleischer ring सिर्फ लिखा. But it's very different. और कभी-कभी MCQs में इसी तरह ही तंग करते हैं. They will give you that the following ring is a sign of keratoconus, and there will be an option of Kaiser-Fleischer ring, and there will be an option of Fleischer ring. The answer is Fleischer ring, not Kaiser-Fleischer ring. So this is a very important sign, and again remember, it's due to iron deposition, not due to copper deposition. And the second important thing, location. Kaiser-Fleischer ring कहाँ था?
Limbus?
Limbus पे था. So is this at a limbus, this Fleischer ring?
No.
It's not at the limbus, it's inside the cornea. So very important thing. So we've discussed three signs now. Hansen sign, Wortstria, Fleischer ring. There are two signs on retinoscopy. वो आपने याद करनी है. I didn't find a good picture of them, and I didn't search for if I find one, I'll send you the link. They are oil droplet reflex and scissor reflex. So read up on those. So these are the signs. So before we go on to the investigation, let's just say that our patient who has these findings or who had these findings, हमें पता लगा कि he went to a previous ophthalmologist and so she got herself checked and all these signs were present. However, when she presents to you now, this patient of keratoconus, or this patient who had rapidly evolving keratoconus, this is how she presented. So she had pain, she had photophobia, she had lacrimation, and she saw halos in her vision. पहले तो थे ही थे, but the yellowing in the vision is getting worse. Describe, if you could describe this picture for me. Circumciliary congestion, the conjunctiva is congestion inflamed. There's an opacity in front of the cornea, right? Opacity or a haziness. Now, when I performed the sodium fluorescent stain, nothing came up. So it's not a corneal ulcer. Slit lamp पे मैंने examination करने की कोशिश की. On slit, the slit is at this plate at the moment. So opacity यहाँ पे भी देखें, diffuse opacification on the lamp. And this is the opacity in front. When I pass the slit over this opacity, this is what I saw. So actually, I know what I'm seeing, but you guys don't know. So that's why I performed an anterior chamber OCT. And this is what came up on the anterior chamber OCT. Focus on this one and this one. So let's focus specifically on this one. This is the normal cornea. This part is somewhat normal. What's abnormal over here?
Thickness.
Thickness. It's great increase in thickness. So it's increased in thickness. There's a bleb over here which contains something clear. So there's an epithelial bleb which most likely contains. But what is this?
Separate layers.
Separate layers, exactly. And that separation in layers and separation of the layers, something which is black, or which is like the aqueous humor, it is present inside the cornea. Is that normally present in the cornea?
No.
No, it's not normally present. So it means that the aqueous has somehow suddenly invaded this area. We know that aqueous is kept out by the endothelium, by the Descemet's membrane. What can you tell me about those two layers in this picture? This would be the endothelium. Is endothelium continuous? क्या आपको लग रहा है कि endothelium is continuous?
No.
No, it's not continuous. No. That is the condition that this is happened. So basically, what has happened? क्या हुआ है इस पेशेंट को?
Glaucoma हो गया?
Glaucoma हो सकता है. At glaucoma, it does not usually infect the cornea. आपकी बात ठीक है कि glaucoma can present with the same things and the same signs. But glaucoma is due to raised IOP. This patient, glaucoma में endothelium basal defect नहीं होता. This patient who had keratoconus, he now presents with corneal haziness. Is accumulation of fluid inside the cornea. Fluid inside the cornea को हम क्या कहते हैं?
Corneal edema.
Corneal edema. There's corneal edema. And what can you tell me about the Descemet's membrane in the endothelium?
It's ruptured.
There's destruction or there's loss. This patient is presenting to us with a complication or another sign of, this is usually a complication, not complication of keratoconus, called acute eye drops. आप मुझे खुद बताएंगे कि why is the Descemet's membrane and the endothelium rupturing in this way? Why is the Descemet's membrane and the endothelium rupturing in this patient? Rapidly evolving keratoconus.
Mechanical stretch की वजह से.
Mechanical stretch की वजह से, exactly. That is the reason why it's rupturing. This mechanical stretch. If this rapid mechanical stretch, if the Descemet's membrane and endothelium, they cannot keep up with the stretch, they rupture. There's rupture, they're tearing in them. And they normally keep the aqueous humor out. Again, they normally keep the aqueous humor out. Keratoconus is somewhat visible over here. Okay, थोड़ा सा में bulge एक नजर आ रहा है. It's not normal contour over here. So this most of these pictures are from before. इनको छोड़ते हैं. in this picture, we can see that this fluid accumulation and there's disruption of these two layers. So mechanical stretch, it causes tearing or rupture of the decimus membrane and the endothelium. And due to that, there's severe and intense corneal edema. This is called acute hydrops. Acute hydrops आपने याद रखना है. ठीक है, थोड़ा ज़्यादा हो रहा है, जज़ब करना मुश्किल हो जाएगा. So let's take it a little slower. आपने साइंस पढ़ ली है, आपने कॉम्प्लिकेशन पढ़ ली. But these they somehow take time to develop. ऐसा नहीं होता ना कि शुरू में ही आ जाए. आपके पास एक शुरू में एक पेशेंट आ जाता है जिसके पिछले एक साल में शायद उसने 2 या 3 मरतबा ग्लासेस चेंज किए. Just want to have an investigation or a test of some sorts which lets you pick up that bulging of the cornea even when these signs aren't present. लेकिन साइंस को बनने में थोड़ा टाइम लगेगा. मंसन साइन भी जब अच्छी खासी केराटोकोनस हमें आंखों से नजर आ रही है, वोट्सट्राया भी हमें स्लिट लम आंखों से नजर आ रहे हैं. So you want to perform an investigation which helps you check, okay, is this patient developing keratoconus? ताकि आप जल्दी ट्रीटमेंट कर सकें and it does not progress to the stage where there are clear clinical signs. What investigations would you like to do?
कॉर्निया का कर्वेचर.
कॉर्निया का कर्वेचर देखना चाहेंगे, बिल्कुल. कोनियोस्कोपी भी करना चाहेंगे, बिल्कुल. ठीक है, तो कॉर्निया का कर्वेचर आप देखना चाहते हैं. क्यों देखना चाहेंगे? Because we know that in keratoconus the corneal curvature is somewhat increased. कोनियोस्कोपी हम एंगल की क्लियरिंग के लिए देखना चाहते हैं क्योंकि अगर कोई केराटोकोनस का पेशेंट है, उनको साथ साथ एंगल भी उनका क्लोज्ड है, तो पहले ही हमने देखा कि उनको स्ट्रेच की वजह से हाई ड्रॉप्स होने के चांस हैं. और एक तरफ से कॉर्निया आगे स्ट्रेच कह रहे हैं, पीछे से आईओपी भी रेस्ड है, तो दिस बिकम्स अ वेरी लाइकली कॉम्प्लिकेशन. वी स्क्रीन देम फॉर कोनियोस्कोपी. एक तो हमने कर्वेचर देख लिया, हमने कोनियोस्कोपी. और आप कुछ करवाना चाहेंगे? There's something else you would like to do?
Corneal surface.
Corneal surface. So corneal surface. आप corneal का surface देख लेंगे. आपने curvature देखना चाहा, आपने surface भी देख लिया. एक और character है. You basically check the cornea in 2 dimensions. There's one third dimension which you need to check.
Thickness.
Thickness, the corneal thickness. So these examinations, they help you. Sorry, these investigations, they help you pick up the disease even when the signs aren't present, and that is why they're done even if these signs are absent. यानी कि अगर आपके पास patient आया है and on history, this history of astigmatism not corrected by glasses or frequent change in history, a general examination पे आपको cataract नहीं मिल रहा, IOP normal है, angle is okay, there's no other signs, so इसकी तरफ point करें, and you want to say, all right, एक मैं investigation करवा देता हूँ ताकि मुझे थोड़ी तसल्ली हो जाए कि इस पेशेंट को केराटोकोनस हो तो नहीं रहा. तो we check these 3 things. Check the corneal thickness, we perform a conioscopy, we check the curvature of the cornea, and एक और बात हो रही थी, corneal thickness, corneal curvature, तो आप repeat कर रहे हैं. Surface, the corneal surface. So these are the principles basically of the investigations which we're about to do. The investigation in which we check the corneal curvature, it is called
Keratometry.
keratometry. We perform a keratometry, the investigation in which we check the corneal thickness.
Pachymetry.
Pachymetry, ठीक है. Pachymetry we discussed in the start. हमने बिल्कुल start में pachymetry कैसे किया. We used to check the corneal thickness. And the investigation on the basis of which we check the corneal surface.
Topography.
Topography. फिर हमने कोनियोस्कोपी का नाम लिया, कोनियोस्कोपी हमने चेक कर ली, कोनियोस्कोपी प्लस आईओपी हम देख लेते हैं, हम ऐड कर लेते हैं फॉर आवर ओन लर्निंग. एंड एक एग्जामिनेशन मैंने वी नीड टू परफॉर्म दीज एग्जामिनेशंस हियर. लेकिन एक और इन्वेस्टिगेशन आपको याद हो, मैंने बिल्कुल स्टार्ट में बताई थी. which we use to check or the count the number of endothelial cells. उसका क्या नाम था? Specular microscopy. So it's not important in this case, but you have to remember that because these are MCQs. So these are what these investigations look like. This is the corneal thickness. Red means के thickness कम है, 9 means के thickness ज़्यादा है, and green means के normal है. Green is usually for normal, so visual aid थोड़ा सा आपको एक मिल जाएगा whenever you're looking at these pictures. So you can see that at this point in this patient, thickness बहुत कम है cornea. When you correlate this with topography, which is elevation at front, you can see that the elevation is also somewhere the most around this area. Okay, and this is the curvature. Means the curvature यहाँ पे कम है, यहाँ पे कम है, यहाँ पर बहुत ज़्यादा curvature है इस area में. The red is 71 and this dull color is around 73, and the figures were also given 103, 96, 76. So इसको मैं 3D image में translate करूँ, if I somehow try to translate this, it means that this is the corneal curvature. The curvature is somewhat normal from the sides, and at the centers, due to the large number, it's somewhat pointed. इस तरह कुछ बनेगा. Not as dramatic as this, but you get the idea. This is how we use these examinations. They tell us a lot. Normal ऐसे नहीं होती. Normal they should have been around green or 10 yellow, 10 either plus blue or yellow. These are the topography, the pachymetry, and the keratometry of a patient who has keratoconus. These are investigations which help us pick up the findings even when they aren't present. Specifically, the investigation which helps us the most is, let me check it for early stages, it's diagnosed by corneal topography. Corneal topography is the first, according to Parsons, which you have to perform. Earliest changes here. Okay. So now you know a lot about this disease. You know 3 or 4 signs. You know the investigations which you have to perform. How will you treat this patient? आप इस patient का इलाज कैसे करेंगे? What is the RX?
Somehow हमने curvature को कम करना.
Somehow हमें curvature कम करना है. So somehow reduce the curvature. उसकी वजह से क्या होगा?
Eyesight.
So you said astigmatism कम होगा. Someone else was also telling something.
अगर eyesight का problem हो रहा है.
eyesight का problem हो रहा है. तो eyesight का problem हो रहा है. ठीक है. Curvature correct करने से basically हमें eyesight का problem correct हो जाएगा and astigmatism correct. Now थोड़ा सा मैं doodling दोबारा करूँगा. This is normal cornea, right? This is the sclera. In keratoconus we have a bulge. In keratoconus we have a bulge, an abnormal bulge which is present just inferior to the cornea. If the light were to pass through this bulge to a maximum point of bulge, do you think it would be refracted more or refracted less?
Refracted more.
Refracted more. So if the light is refracted more, it means that the patient will most likely have myopia. And he will also have astigmatism because the curvature is not uniform. यहाँ पे बल ज़्यादा है, यहाँ पे कम हो जाएगा उसमें. So it will be astigmatic myopia. The visual मतलब जो refractive error होगा, that will be astigmatic myopia. So we need to correct that astigmatic myopia. Plus we need to help somehow prevent this complication. The most important thing, these are the important principles on the basis on which we manage. Now, corneal curvature कम हम करें. That was what someone said. Corneal curvature हम कैसे कम कर सकते हैं? Think about it, and you will come up with an answer. At least one of these options will be filled. How can you reduce the corneal curvature? Corneal curvature.
Laser.
Laser. लेजर से आप कॉर्नियल सर्फेस पे बिल्कुल काम कर सकते हैं. What is laser actually? लेजर क्या है? मतलब लेजर इज द लेमन टर्म फॉर अस ना. हम कहते हैं कि आंखों के लेजर करवा लें. लेजर होती क्या है? I'm not asking for the definition of laser या light amplified light signal और वो चीजें. It's actually a surgery. ठीक है. लेजर जो हम कहते हैं लेजर क्या लेजर पाथ कहते हैं. It's actually surgeries. However, we do not perform those laser surgeries because they are for myopia or hypermetropia, which are stable and they do not involve astigmatism. हम इस पे भी surgery perform करते हैं. The principle is just somewhat a little different. In this case, we need to do something which corrects the curvature of the cornea. Basically, जो cornea outer part है, उसका curvature correct करे. So we transplant. We perform a keratoplasty. Exactly. We perform a keratoplasty. Now, which type of keratoplasty?
Partial.
Partial. We can perform. ठीक है, partial perform करते हैं. Partial में आगे कौन सी type perform करते हैं? Okay. तो थोड़ा सा इसमें ये है कॉन्सेप्ट है कि वो स्टडीज हैव फाउंड आउट दैट कि आगे वाली लेस को हम ट्रांसप्लांट कर लें तो इट हैज अ बेटर आउटकम एंड बेटर इफेक्ट. वी डू नॉट नीड टू परफॉर्म अ ट्रांसप्लांट ऑफ द होल कॉर्निया. तो वी परफॉर्म अ पार्शियल केराटोप्लास्टी. अब पार्शियल में मैंने आगे एंटीरियर लैमेलर की बात की थी, फिर एक डीप एंटीरियर लैमेलर की बात की थी. द प्रोसेस ऑफ चॉइस और द सर्जरी ऑफ चॉइस keratoconus is deep anterior lamellar keratoplasty. This is an MCQ. एक तो आपने कहा कि चलो हम सर्जरी करके इस कॉर्नियल डिफेक्ट को करेक्ट कर लेते हैं जिसकी वजह से मसला था. दिस वाज आवर keratoconus, my polyton keratoconus. So you said, all right, we need to correct this thing, and after we have corrected it, it will come back to this normal. सर्जरी. सर्जरी के अलावा आप और क्या कह सकते हैं? एक तो ये सर्जरी है ना, उसके अलावा भी एक सर्जरी मैं आपको बताऊंगा. बट व्हाट एल्स डू यू थिंक कम्स इन योर माइंड कि हम क्या कह सकते हैं? Is there any other way with which we can correct this bulge? ये ज़्यादा bulge निकला हुआ है.
Contact lens.
Contact lenses. Basically, myopic astigmatism in keratoconus it occurs because there's abnormal bulging from one part of the eye. If we apply contact lenses, specifically made contact lenses, what they do is that they cover the normal cornea, so that this corneal surface or the surface which is the refractive medium between the eye, the surface which is acting as a medium between the air and the rest of the eye, that surface is flattened. Cornea यही कहते हैं ना कि air से जो light आ रही है और बाकी इसके अंदर घुसती है cornea के अंदर, so it's refracted. The cornea is uneven, so that refraction is uneven. If we even out that cornea by the application of a contact lens, that can be corrected. So yes, contact lenses are one of the treatment options in keratoconus. और हम क्या कर सकते हैं?
Rings.
क्या कह सकते हैं?
Rings.
Rings.
Corneal rings.
Corneal rings. Corneal rings. Corneal rings क्या होते हैं आपको? Basically, what corneal rings do is that is an abnormal curvature or a keratoconus. These corneal rings, they are inserted over here and they compress the cornea. And थोड़ा सा इसका लंबा concept है. And all you need to do is that they flatten the curvature of the cornea. In simple terms, they flatten the curvature and they help. So we have contact lenses, we have corneal rings, we have deep anterior lamellar keratoplasty. और क्या हम ट्रीट कर सकते हैं? There's one more treatment you have to know because they ask for 4. हमें इस बार प्रॉफ में 4 ट्रीटमेंट्स का पूछा था. 4 साइंस बताओ और 4 ट्रीटमेंट्स बताओ.
Glasses नहीं use कर सकते.
Glasses can be used in earlier stages. Glasses helpful in early stages. In early stages, however, there will come a time after which the person will not be, his keratoconus will not be treated. There's one more thing other than the glasses. एक और चीज़ है. Glasses अगर use कर सकते हैं only in early stages. Remember, after that the keratoconus astigmatism becomes so severe that you have to come to another modality.
Laser हम नहीं use कर सकते. वो मैंने miss कर दिया था. मैंने सुना.
So laser है, it's actually a surgery. It's a laser in situ keratomileusis. The process is actually keratomileusis. In keratomileusis, you cut out a part of the stroma and you keep the normal epithelium over it. और stroma की आप thickness को आप change करते हैं. Due to the pathology of pathophysiology of keratoconus, जहाँ पे मसला आता है, the problem is with the outer layers of the cornea, not specifically the thickness of the stroma. So if we have just perform a change of the thickness of the stroma, we will have to perform a change all around. मतलब कि कहीं जगह थोड़ा stroma ज़्यादा thin करना पड़ेगा, कहीं जगह कम thin करना पड़ेगा. So in order to have a uniform effect all over the cornea, ताकि सारी जगह का मसला एक साथ ही हल हो जाए एक ही चीज़ के साथ, we just take out the anterior part of the cornea and we replace it. Keratomileusis में ये है कि somewhere the thickness somewhere the thickness of the cornea is less and somewhere closer to the keratoconus it's more, right? Keratomileusis में ये होता है कि a uniform part is taken out by a laser. Lasers आप obliterate कर देते हैं uniform part. But as you can see in this case, it will not help because in this case इसमें ज़्यादा thinning हो जाएगी और इसमें insufficient thinning होगी. In order to avoid this whole process और इस सारी झंझट से बचने के लिए, they simply replace or transplant the cornea. The last thing is riboflavin therapy, which you should study on your own. आप इसमें paragraph पढ़ लेना, you will better understand what this is. So, contact lenses, corneal wings, and corneal wings, deep anterior lamellar keratoplasty, and riboflavin therapy. These are 4 treatment options which you have to remember. Contact lenses, specifically hard contact lenses, not soft. So, 4 signs of keratoconus, 4 treatments of keratoconus. This is actually intracorneal wing segment. Either डला हुआ है. I've shown you this image before. This is a pseudotelium. This is a pseudotelium, right? This was your keratoconus. Keratoconus, most important presenting complaint is astigmatism that does not correct with glasses, Munson sign, Wurtz-Straya, Fleischer ring, the investigations which you need to do or which pick up the changes, and the 4 modalities of treatment. So the last 2 things are very simple, and you just have to tell me. These are the names of certain diseases जो अभी आपको बताने वाला हूँ, and they have associations. You only need to remember those. तो MCQs में आ जाते हैं, otherwise they're not much important. So if you look at these 2 pictures, what comes in your mind? First thing that should come into your mind.
Exophthalmos.
Exophthalmos. Exophthalmos किसमें होता है?
Hyperthyroidism.
Thyroid eye disease.
Thyroid eye disease, hyperthyroidism. So, this patient, what does she have?
Bell's palsy.
She has Bell's palsy. Okay. So, what is common between these 2 conditions in regard to the eye? इनकी Bell's palsy right side की है. क्या common है इन दोनों conditions में? What is common between these 2 conditions?
Eyes सही तरह close नहीं होंगे.
Eyes सही तरह close नहीं होंगी. So, if these 2 patients, they were to develop any abnormality of the cornea due to improper closure of the eyes, what would I call that? क्या मुझे कहना चाहिए उसको? Their eyes are somewhat exposed to the environment even when the patient tries to close them. यानी कि patient की रजामंदी के बगैर the eyes are open and they're exposed to the outside surface, outside world. So in these conditions in which the eyes are not able to close properly and corneal lesion or any corneal pathology develops, that is called क्या कहेंगे उसे? It's not an ulcer, but it's a corneal lesion. Ulcer नहीं है तो हम kerato means cornea, हम keratitis use नहीं करेंगे. We will use a pathy. So it's a keratopathy due to exposure. That is what this disease is. Exposure keratopathy. किन लोगों में डिजीज होता है? Exposure keratopathy.
थायराइड आई डिजीज में होता है,
थायराइड डिजीज में और
Bell's
और
palsy.
बेल्स पाल्सी,
बेल्स पाल्सी में होता है. थायराइड आई डिजीज, बेल्स पाल्सी, लैक ऑफ थैलमस, कोमा में, in any condition in which the person is not able to close their eyes and due to that they develop abrasions, they develop ulcers, non-infectious ulcers, exposure, wind की वजह से, anything like that. That is called exposure keratopathy. Now, exposure keratopathy, if it is due to neurological causes, meaning that there is paralysis of a muscle. For example, in the case of Bell's palsy, there is a paralysis of the muscle. In those cases, it is called a neuroparalytic keratopathy. Names are pretty self-evident. Keratopathy, it's not an infection, but there's a corneal lesion. Exposure due to exposure, and if there's a neuroparalysis and the eyes are not able to close, and that causes this disease, so it's a neuroparalytic keratopathy. These are two important diseases which are which come as MCQs, and they confuse if you don't know what they are or what they're causing. So, keratopathy, neuroparalytic. Similarly, what is common between herpes simplex, herpes zoster, and neurotrophic keratitis? तीसरा नाम थोड़ा सा अजीब है, you haven't heard of this for the first time. But what is common between the two?
नर्व्स इन्वॉल्व हो रही हैं.
Nerves involved हो रही हैं. These both are viral and they involve nerves. Nerves involved हो रही हैं, तो they had a peculiar symptom which we discussed last time. What was that symptom?
पेन,
पेन नहीं हो रही थी इन्हें.
एनेस्थीसिया.
Corneal anesthesia. So there are three conditions which have corneal anesthesia: herpes simplex virus keratitis, herpes zoster ophthalmicus, and the third is neurotrophic keratitis. Neurotrophic keratitis होता इस तरह है कि in the past there was a treatment for a disease which is disease का नाम है, क्या नाम है इसका? Trigeminal neuralgia. Trigeminal neuralgia आपने सुना होगा. In the past, trigeminal neuralgia was treated by the injection of alcohol into the trigeminal ganglion. उसकी वजह से क्या होता था? corneal anesthesia होता था, and the cornea, it was not able to maintain itself, not able to nourish itself, and due to that specific condition, anesthesia or local alcohol injection, the condition is called neurotrophic keratitis. ये चीजें याद रखनी है, and this ends our session. टाइम खत्म होने लगा है. नेक्स्ट सेशन विल डिसाइड कि हम कब से दोबारा स्टार्ट करें, ताकि इंशाल्लाह कल ईद हो जाएगी. तो आप सबको ईद मुबारक हो, एंजॉय करना. एंड नाउ दैट